A discussion of the sources of pathogens would not be complete without mentioning sporulation. Remember, there are two genuses of pathogenic bacteria that have the ability to sporulate and form endospores. Those are Bacillus and Clostridium. Sporulation produces an endospore, which is essentially an inanimate form of the pathogenic organism. As far as we know, bacterial spores can survive indefinitely in the absence of water, extremes of temperature, and very harsh conditions. And as long as they exist, spores are a source of infection, because as soon as a spore gets itself into a desirable environment, which would be a nice, warm, wet human body, it can return to the vegetative state and cause disease. We should also mention nosocomial sources of infection, and all that term refers to is hospital acquired. Unfortunately, our hospitals are a significant source of pathogens and lead to too high of a number of infections in hospitalized patients. A nosocomial infection is an infection that is acquired during a hospital stay. So in other words, the patient comes in with one problem and develops the infection while they're at, having the hospital stay. We estimate that anywhere from 2 million to 4 million nosocomial infections happen every year. And they are the cause of anywhere from 20 to 40,000 deaths per year. As we've discussed in laboratory, it's very difficult to fully disinfect the hospital setting. And hospitals have to put a lot of time and effort and money into programs to control the spread of infectious disease within their walls. Both obligate pathogens and opportunistic pathogens tend to cause nosocomial infections. Remember, these are people that are being hospitalized for something else. So their normal immune function, their normal barriers to infection are compromised, and an opportunistic pathogen can take advantage of that. Another problem is that nosocomial bacteria tend to be antibiotic resistant. And if you recall our discussion of horizontal transfer of genetic material, the plasmids that carry antibiotic resistance genes can be spread from bacteria to bacteria in a hospital setting. This table comes out of a textbook, and it just shows us the different body sites where nosocomial infections tend to occur, and what percentage of all nosocomial infections those sites encompass. As you can see at the top of the table, the urinary tract is a particularly susceptible system in the body for nosocomial infection. About half of all nosocomial infections involve the urinary tract. When people are in the hospital, they all often have to be catheterized so that they can urinate easily through the catheter. And unfortunately, that catheterization process and the fact that urinary catheters are often left in place for a while, those both contribute to the development of urinary tract infection with nosocomial pathogens. Surgical sites are second on the list. Intestinal surgery is particularly problematic, as you might guess. Anytime that you are penetrating into the intestinal cavity, there are so many microbes in there ordinarily. Introducing a nosocomial pathogen in there is only going to cause more problems for the patient. Joint replacement surgery is another particularly problematic time for nosocomial infections. Joints, as you learned in anatomy, are normally sterile areas So anytime the surgeon has to open a joint cavity in the operating room, we run the risk of a nosocomial pathogen gaining entry. The lower respiratory tract is another site, about 12% of nosocomial infections. So by lower, we are referring to the alveolar portions of the lungs. Machinery that's intended to help people breathe and keep them alive, like respirators and other breathing aids, those things can sometimes introduce nosocomial pathogens into the lower respiratory tract. Blood infection is problematic in hospitals, and of course, there are other ways that pathogens can gain entry into a hospitalized patient. So sometimes pathogens are transmitted host to host directly. Sometimes the infected host is going to be the source of infection for the next host. And direct transmission can happen through a variety of ways. The other type of transmission then would be the indirect route. And this is when the host, the infected host, contaminates something like a fomite or gets bitten by a vector that picks up the infectious agent. And then the infectious agent travels to the next host. So there's direct transmission, which is host to host, and then indirect transmission, which is host to something else to host. During direct transmission of pathogens, it can come through plain old physical contact. It can come through touch. It can come through kissing, through sharing of eating utensils or food. It can be transmitted through blood. It can be transmitted through sexual fluids, bites, um, human to human or animal to human can certainly be a form of direct transmission. Um, Pathogens can spread from mother to fetus through the placenta. And pathogens can certainly spread from host to host through the air. We are seeing that type of transmission, that direct transmission during the current pandemic. You'll notice that I have the word aerosol with an asterisk next to it because a truly airborne pathogen is simply in the air, and the SARS-CoV-2 virus is not a true airborne or aerosolized pathogen. Instead, that coronavirus is carried in droplets of fluid that people expel when they sneeze or cough or speak loudly or sing. So it's not a true aerosol transmission, it's a droplet transmission with that virus, but it can still be direct, host to host. The SARS-CoV-2 virus can also spread through fomites, through indirect transmission. Remember, sometimes it's a fomite, sometimes it's food and water that's carrying a pathogen from host to host. Sometimes it's a vector that's carrying the pathogen from host to host. When a pathogen is transmitted from one host to another host, there are certain steps that have to take place in order for that new infection to occur. Remember, there's a difference between exposure and infection. Pathogens have to be able to not only get into the host, but they have to be able to multiply. They have to be able to penetrate, multiply, and then they need a way back out of the body in order to infect the next host. So I want to talk a little bit about routes of entry and exit. One of the most obvious ways to put a pathogen into a host body is through injection. Needles, of course, if they were contaminated with something, again, like the hepatitis C virus, could be a source of transmission and could get that pathogen, that viral pathogen, into the host's body. But there are other types of injections into the skin, and those include things like deep scratches, or animal bites, or insect stings. All of those things serve to inject the pathogen into the skin. Another route of entry is through the mouth, and the mouth, unfortunately, is a problematic route for a lot of pathogenic disease. The mouth, of course, leads directly to the gastrointestinal tract, and so if it's a gastrointestinal pathogen, the mouth is a good way for that pathogen to gain entry. Remember too that the gastrointestinal system leads out again through the feces. So if the pathogen is expelled in fecal material, it's possible for that the person who has the infection to get that fecal material on their hands while they're in the bathroom, and then spread that pathogen to other locations, either directly to the next host or to fomites. We refer to this route as the fecal oral route. In other words, when the pathogen is transmitted through the feces and through bathroom habits, the infected host picks up just a small amount of fecal material on their hands, and then they transmit the pathogen by touching things with their contaminated hands. And then the next host picks up the pathogen and introduces it into their mouth. That's the fecal oral route. It's also quite possible for the mouth to be involved in the transmission of respiratory pathogens, and that's because the mouth also connects to the respiratory tract. Remember, the mouth, the nose, and even the eyes link back into the back of the throat, into the pharynx, and can then go down into the trachea. A lot of people don't understand why, for example, you can't touch your eyes right now with the SARS-CoV-2 virus. When it's a respiratory pathogen, it's not an ocular pathogen. And the answer is, of course, that if you were to transmit those viral particles into your eye, your tears would flush those viral particles into the lacrimal duct. And remember, your lacrimal duct exits into the back of your throat. So the eyes are a route for pathogens to gain access to the respiratory system. It's also obviously a route for ocular pathogens. In other words, if it's a particular ocular pathogen, touching your eye will introduce the pathogen. Gastrointestinal to urogenital is another route. Again, if we think about bathroom habits, if there's a pathogen that's in fecal material, depending on a person's bathroom habits, they can contaminate their urogenital system with that fecal material and pass the pathogen that way. It's also possible for a urogenital pathogen to gain entry through the urogenital system. And finally, the blood. The blood is a source of certain pathogens through the placenta from a pregnant mother to the fetus. And the vagina itself can also be a source of pathogens. If you think about, for example, certain streptococcus organisms that can be transmitted during the childbirth event itself. Pathogens have routes of entry. They have very specific routes of entry, and that's because pathogens tend to infect very particular types of tissue. Sometimes there's a singular route of entry, and sometimes there are multiple routes. And again, if you look at the current coronavirus, it can gain entrance through the mouth, through the nose, through the eyes, And that's why we all have to be so careful about washing our hands right now and not touching our faces. It's important to remember, though, that pathogens cannot cause disease outside of their particular routes of entry. You've probably heard people talk about, for example, the stomach flu. There's actually no such thing as the stomach flu. Influenza is a respiratory pathogen. It's a virus that infects respiratory tissue. It's unable to enter gastrointestinal cells. So if you were to take influenza virus into your gastrointestinal system, it would just pass through. It cannot cause disease outside of its specific routes of entry. Another good example is intestinal pathogens can't cause skin infections. It's just not possible. They're not able to enter um, routes that lead to tissues they're unable to infect. And of course, as I mentioned a minute ago, we have to remember that sometimes routes of entry can be connected to the tissues that a pathogen infects in very mysterious ways. So, a respiratory pathogen like the coronavirus that has been placed on a doorknob gets picked up by the hands of a potential host, and then that person rubs their eyes with those contaminated hands, and the pathogen then gets transmitted onto the surface of the conjunctiva. The tears then wash it off of the conjunctiva into the lacrimal duct, which empties into the pharynx, and then the pathogen is transported to the respiratory system. So sometimes these routes are a little convoluted, but they do get the pathogen to the tissue or the organ system where it can cause infection. The last point I want to make today about pathogens and how they spread relates to the fact that it's not always about biology. Yes, the transmissibility of a pathogen from host to host is very dependent upon the biology of that pathogen, and that's everything we've been talking about today. But the transmissibility of a pathogen also depends upon cultural factors and socioeconomic factors. So by cultural factors, we could be talking about things like whether or not a particular host eats with their hands, if that's a normal cultural practice for them, how frequently that person bathes, what their particular hygiene practices are, what their sexual practices are. There are lots and lots of cultural factors that influence the transmission of infectious disease. There are also, unfortunately, socioeconomic factors involved. The number of people who are living in a particular home, for example. Um, there are instances where there are a whole lot of members of one family who live in a relatively small apartment in a relatively low number of square feet. Whether or not that family has access to clean water and is able to routinely wash their hands or practice good hygiene, whether or not they have the financial ability to buy good cleaning products, whether or not they have any control over what kind of vectors they get exposed to in their home, the quality of their diet, and how that impacts their overall immune health. All of these things impact the transmissibility of infectious disease. So when we think about pathogens and how they spread, yes, we have to think about all of the biological features of that, but we also have to think about cultural factors and socioeconomic factors if we want to control the spread of disease.